for since 2006. Dr. Wakankar is a postgraduate in graduation in 2006, and she is practicing as a veterinary surgeon and completed her practice continuously. And she is one of the consultant for the Sanjay Gandhi National Park also in Mumbai as the ophthalmic case for the wild animals. So I request Neha ma'am, please take the session. Thank you.
Good afternoon, all of you. Let's start with the session. Welcome to N2 Meet Online, and we start with the session shortly. So, our today's topic is diagnostics in veterinary ophthalmology, and our speaker is Dr. Madhura Kulkarni. She is a very renowned young veterinary surgeon in Mumbai. She's completed her BVSc from Mumbai Veterinary College, her MBSc from Jabalpur Veterinary College, and her PhD from Mumbai Veterinary College. She's worked as Senior Research Fellow at Arden Veterinary College, and the project was on progressive retinal atrophy in dogs. She has traveled to many countries to learn ophthalmology and orthopedics, and she has around more than 10 years of experience in general surgery and orthopedic surgery. She is currently leading 3 clinics. She is the director and proprietor of Shivaji Park Animal Clinic. She is founder and director at Vet7 Ophthalmo, and she's founder and director at Uptown Vets Multi-Specialty Clinic. So now let's welcome our panelists. Dr. Narendra Chauhan. He is the director of Myra Pet Clinic and Surgical Center from Indore. He has done his BVSc from Mau Veterinary College, MVSc from Mau Veterinary College, and he is involved in veterinary ophthalmological practice since 2011. He has traveled to many countries to learn ophthalmology, and he is also doing many ophthalmic surgeries in different countries and India. And he has got many awards during his career. The second panelist is Dr. Piyush Dubey. He is director of Pet Medic Small Animal Veterinary Care Center, Bilaspur. He's completed his BVSc and AH, and he has more than 15 plus years of experience. His keen interest areas are surgery, emergency critical care medicine, ophthalmology, especially intraocular and extraocular surgeries. Then let's welcome Dr. Duggley. Dr. Nilesh Duggley is a renowned veterinary clinician in Mumbai. He is also assistant professor in Mumbai Veterinary College. He's worked for more than 25 years in this field. He has published around 34 research papers and guided 5 PG students and co-guided more than 25 PG students. He is also co-principal investigators of 4 research projects. And Dr. Hitesh Swali, he is a leading veterinarian from Mumbai. He is graduated in 1995 from Mumbai Veterinary College. He comes from a veterinarian's family. So he shares keen interest in small animal practice. And presently he is working as the honorary treasurer for PPM and honorary trustee at Feline Foundation. Thank you. So now I request Dr. Madhura to start with the session, please.
Okay, good afternoon, everyone. Uh, Thank you, Dr. Neha, for such a wonderful introduction. I would like to discuss today something basics and advanced regarding the diagnostics in veterinary ophthalmology. Firstly, according to me, if you want to have a good treatment, the diagnostics have to be on the spot. So let's begin with this. Basic coming to the anatomy. If your anatomy is good, the diagnosis becomes good. And if the diagnosis is good, your treatment becomes good. So for me, the eye is an important and one of the most complex sense organ that we are endowed with. It helps us in visualizing objects with light perceptions, color, and depth perception. Now, eye has various segments and chambers. The eye is divided into two segments. First is the anterior segment and the posterior segment. The anterior segment ranges from cornea to lens. The posterior takes it ahead from lens to retina. The anterior divided into anterior chamber and the posterior chamber. The anterior chamber starts from the cornea to the iris, and the chamber ranges from iris to the lens. Now, the base layer, the vascular layer, and the nervous layer. The fibrous layer, the vascular layer comprises of the choroid, the ciliary body, and the iris, and the nervous layer comprises of the retina, which is the most important in our vision. Now the tear film is comprises of three layers, that is a lipid layer, the aqueous layer, and the mucous layer. Lipid layer is the outermost layer, the aqueous layer is the middle layer, and the mucous layer is the innermost layer. So lipid layer is responsible and secreted from the meibomian gland. It slows the evaporation of the aqueous layer. The aqueous layer is the thickest layer. It helps in secreting the lacrimal gland. We'll be further discussing it only. Schimmer tear test. This is the main layer which the corneal epithelium. It washes out debris and does the exchange of substances through the cornea. The last one is from the conjunctival goblet cells. It plays a vital role in the stability of the tear film. It converts the hydrophobic corneal epithelium to hydrophilic. It lubricates the ocular surfaces and protects the cornea. Now, coming to the cornea, one of the most prime part of the eye, its function is to transmission and the diffraction of light. It is a clear transparent tissue due to the absence of blood vessels and the orderly arrangement of the membrane, and the last one is the corneal endothelium. Corneal endothelium is the innermost layer which cannot regenerate. It can maximum regenerate in young, which is made up of the choroid. The last one on the knee is the retina, which is the innermost layer of the eye from where we see the reflecting of the lights. It is responsible for detecting the light. Retina has two types of photoreceptors, which are the rods and the cones. So these are basically cones. Rods are 120 million, they detect light. Black and white. Cones are 7 million, they detect the color. They are present all throughout the retina. They convert the light into the nerve impulses. We'll be discussing about the rods and the cones. Once the light falls in the cornea, it goes transfers to the lens, then to the rods and the cones, then bipolars, then the ganglion cells, then the optic nerve head, and then hits the visual cortex. This is how the vision is seen. Now, coming to the diagnostics and the major part of our session. Now, while doing the first ophthalmic examination, now what I do is generally the pet enters the clinic. When I see a pet, once I see the pet, I tell him to walk towards me, like whether he's coming towards me, how is he walking, whether there is redness in the eye, whether there is a very important for me. Whether it's tilting towards one side or not able to see. I do an obstacle test. It's a very, very easy test where you put obstacles in between and you just make the pet walk through it. If he bangs against this, you get a little hint that he is not being able to see. And once the pet approaches with the pet parent, you take a good clinical history that when was this onset of problem? Since how long is it going? The first thing when the pet says if it's going from so long, it means it's a chronic problem. And if it's from like a day or two, it's an acute. So you get a generalized idea how you have to treat the pet. Then any kind of discharge is there from a pet's eye that indicates a lot of thing like a mucus discharge, like a watery discharge. That's very important. And how is the day vision and the night vision? Because many of the retinal disorders which happen are related to the day vision and the night vision. Like how is he seeing in the day, whether he's seeing less in the day and more in the night, or less in the night and more in the day. Now, coming to the examination, I do a basic, once I take the patient on the table, that's the pet on the table, I'm little being friendly to him. How he is, he, whether the symmetry is okay, whether the bulging is okay. And I just with the thumb and the index finger, I check the facial symmetry to see any kind of abscess or any kind of bulging is seen. Once that is done, then I further move to the further test. Sometimes the pet exhibits exophthalmos, bophthalmos. These are the two cases. Now, exophthalmos is a condition in which the eyeball is completely normal, but some space occupying mass is pushing the eyeball ahead. That's why so you see a bigger eyeball, maybe an abscess, maybe a mass, any kind of detachment that can happen. And in bophthalmos, the orbit is completely fine, but there's something wrong with the eye that makes the normal eyeball look big, like glaucoma, uveitis, etc. Now, coming to the first part of the diagnostic test, that is the Schirmer tear test. I do this test before anything because before handling any of the eye, there is chances that the lubrication might increase in the eyes or it might decrease. The pet might get irritated. The eye might change to red. So first and foremost, which I do is this is the Schirmer tear test. These are the Schirmer tear strips which are easily available in the market. You just have to fold them from the corner and put near the canthus, basically lateral canthus, advisable. It basically measures how much tear eyes are produced, whether they are producing enough lights or enough tears or not enough tears. They basically diagnose dry eye syndrome or KCS. Now, KCS is very common in pugs. So this is very important that we do this test in pugs. Now, the healthy eye emits generally more than 15 per minute of tears, borderline KCS around 10, intermediate KCS around 5 to 10, advanced KCS around 1 to 5, and end stage KCS around 0 to 1. So it is a very, very important test which gives us the basic idea of the tear production. Now, next coming to a neuro-ophthalmology assessment, one of the major tests in veterinary ophthalmology. Now, the first test, what we begin with is a menace response. Menace response is nothing. We cover one eye with one and stimulate the other, avoiding air currents. It's done similarly with the second eye. So you see there's a blinking. I cover it one hand. There's a blinking. I cover the other eye and do the reflex. There's a blinking. So this is one of the most important for vision. The afferent response is through the retina and the optic nerve, where the efferent response is through the ipsilateral facial nerve. Make sure you do this air current movement very gently and very softly, because sometimes it can give a false positive result. Now, second, coming to the palpebral reflex, we touch the medial and the lateral canthus very gently to see the movement of the eyelids, that's the palpebral fissures. If that is positive, then the trigeminal pathway and the facial nerve pathway is completely normal. Then coming into the pupillary right reflex, we illuminate the eye in the dark and we see the constriction of the pupil. So you can see there's a typical constriction of the pupil. That means the PLR, that's commonly called pupillary right reflex, is positive. It is associated with the oculomotor nerve. Coming to the oculovestibular movements, I generally do this test routinely. Some doctors do it, some don't, but I do this test. It is basically movement of the head of the patient from side to side or from up to down, and then side to side to see any kind of nystagmus, any kind of pain in the neck, any kind of pain in the ears is there. This is basically done to see any kind of lesions are there in the neck, ear, or the eye, because any kind of pressure the things are putting on the eye. Now coming to the tonometry, that is the intraocular pressure measurement. This is a technique which is called as tonometry. It is measured by, there are two advanced instruments which are used, that is Tonovet and Tonoplus Plus. I use an advanced version, that is the Tonovet Plus. The normal intraocular pressure of the eye is 15 to 25. Now, generally, you can get high readings if you press the neck. If you put a little pressure over the neck, you can get high readings. So it's advisable that if you get a reading about 25, if you feel the pet's eye is quite healthy and still you get a reading about 25, you make sure you're handling the pet well. And you can do the readings even again after 5 to 10 minutes. The positioning of the patient is very, very important in this. These are rebound tonometers. There are different settings for different species only in one instrument, and there's no need of topical anesthesia. And the two instruments which I explained is Tonovet and Tonovet Plus. This is the Tonovet Plus, which I am using currently. And this is how we measure the intraocular pressure. You just put a pin, and there's a small needle to it. You just bang it against, it's a small pressure. You bang it against the cornea and it gives you an accurate pressure. It's a completely non-painful procedure. Coming to a chromatic PLR tester. Now, this is a tester. It's like a small torch which has a blue and a red light. It is a unique diagnostic instrument for rapid screening of retina and the optic nerve functioning using evaluation of the pupillary light reflex. Means when you shine a blue light, you get a positive PLR. If you shine a red light, you get a positive PLR. A blue light has a wavelength of 480 nanometer wavelengths, which activates the cones, basically the short and the medium long wave cones, that is opsins, melanopsins, and rhodopsins. The red light, which is of 630 nanometer wavelength, can't activate short wavelength cone opsin and melanopsin. But it means that red light stimulates the activates both the rod and the cone pathway. So any pathology you see in rods, cones, and or inner retinal neurons, it results in decreased PLR response to light. So though you get a positive PLR for the blue light, but if you get negative PLR for the red light, it means there is some disturbance in the rod cone pathway. So you have to go for further investigations. Now, this is a CPLR, that is just I explained chromatic PLR. It is like a red light, and this is the blue light. It is a chromatic PLR tester. And it's quite a good instrument where you can easily recognize and diagnose it. I'm not saying it gives you 100% diagnosis whether the dog is visual or not, but it gives you at least 50 to 60% that whether the dog is visualizing, he can see or he can't see. Now coming to a slit lamp biomicroscopy. It is a handheld magnifying microscope with a light source that shines a narrow shine of light. It's like a slit lamp. It's like a slit beam. This allows to see us in the front of the eye in high magnification. The magnification goes very high, that is around 10 to 16 times. So it is very, very good for examination of the cornea. That is the anterior chamber, the iris, the lens, the sclera, the conjunctiva, and the eyelids. Basically, any condition related to the cornea is seen amazingly. You can see corneal ulcers, the depth of the corneal ulcers, the perforation of the epithelium. Also, there are three conditions called as ectopic cilia, distichiasis, and trichiasis. These are seen quite clearly with the slit biomicroscope, and it works wonders to get the diagnosis right in place. Only the thing with this instrument is you need a lot of practice. Every morning you have to focus this biomicroscope at least for 20 to 30 minutes to get a good image, and then you can start practicing on the pets. Plus, you have to come very close to the pet to see this, see the magnification of the cornea. So if a pet is very aggressive or he's not allowing you to handle, then you have to muzzle them up and then see it. But if you want to invest, this is a good instrument. Coming to the aqueous flare, this flare is seen only with a slit lamp biomicroscope. Aqueous flare is nothing but when the dog has uveitis, that is, there's an inflammation of the iris choroid or the ciliary tract, the eyes uveal tract. You get a typical fog-like image. This is like a Tyndall effect. It's called as a small fog-like effect. It's like headlights in the fog. So when the headlight is there and the fog is, if you focus a headlight of the car and there's a fog in front of you, the whatever you will see is the same thing you see in this effect in the anterior chamber. This is called as a Tyndall effect. It basically happens when the blood aqueous barrier is compromised due to the injury and is visualized in a small direct beam of light, which creates the headlights in the fog in the anterior chamber. And this is only seen by a slit lamp biomicroscope. Rest of the instruments is very difficult to see. Now, coming to the very next basic examination, which is the fluorescent staining. Most of you must be knowing fluorescent is a water-soluble dye that helps us to identify corneal ulcers by adherent to the stroma and the basal layers of the damaged cornea, which appears as a bright yellow-green stain on the defects, and it is seen under the cobalt blue light. Fluorescent stain is also used in helping identifying perforations. It is good. It can give us a positive Sedal test also. What is a Sedal test? It's basically when you put this fluorescent stain on the bulbar conjunctiva or just on the small on the cornea, there might be an aqueous humor leaking from a full thickness graph. So you can see a clear small green line, which is a positive Sedal test. Now, these are the some patients which I had seen. There are a few pictures from my practice where the fluorescent stain was positive. Now, this was one picture. It was a fresh ulcer. This was quite a chronic ulcer. You can appreciate there are small hair over here. That's why it was irritating the cornea. Also, mild vascularization with dryness. This is the vascularization with dryness you can appreciate, which was resulting into the persistent corneal ulcer. So what I did was first I treated the ulcer and then I put them on some medication so that it can help in preventing further corneal ulcers. This was a fresh one. It was further debrided to heal it. This was a small pinpoint. And then this was a recent one in a poodle. The history was the poodle had got for grooming, and after coming from grooming, some irritation was developed in the eye. So that poodle was not opening the eyes. So when it came to me, it was very difficult to examine. So firstly, the pain had to be managed, and then I could stain his eye to see it was almost occupying around 80% of the cornea. But now with the treatment and everything, basically I did a grafting for this. Is absolutely fine. With this same test, like when you go for fluorescent test staining positive, with the same test, you can further see once you put a fluorescent stain. Now, this pet had come to me with a corneal edema. So I had to check that corneal edema is due to an ulcer, due to anything else. So when I put the fluorescent stain to check whether there's a corneal ulcer or not, at the same time, I check the outflow and to see the drainage of the lacrimal system. For my thing, it was the Jones test was positive. Basically, this is a Jones test when you put when you put a fluorescent stain into the eyes and it drains to the lacrimal gland. Sometimes it can be false positive also, but then you can put it in the other eye and also check the same. This is very good in cases of excessive tearing, where there is epiphora and when you feel there's a damage of the lacrimal glands. Now, coming to corneal cytology, culture, and sensitivity, I have used like 2-3 times this, not much, but it is a very good tool in the management of corneal ulcers, and it is very good in any complicated or slow healing ulcers. The corneal cytology should ideally be performed by using a cytobrush to generate harvest surface corneal surfaces, which can be transferred to a clean glass side. This is like a cytobrush. This is the magnified version. That's why you can see it's so big. But this is a very small brush. You just have to brush away the corneal cells from the epithelium very gently. That is why a smaller sampling tip is preferred. It is very important to take great care when sampling for cytology or culture, because when there is a corneal ulcer or any kind of corneal perforation, there is a chances that there might be a damage with the cytobrush. So it is very, very important. Do it very carefully and gently. And further, when I do this, I generally take the sample on the slide, I make the slide, and I send it to a pathologist for further evaluation. Now, coming to ophthalmoscopy, one of the very good tools in ophthalmology. There are two types of ophthalmoscopes. One is direct and one is indirect. Direct means you see directly into the eye of the dog or the pet, and indirect is you used a passive thing to see in the eye of the pet. Now, direct ophthalmoscope is basically to view the optic nerve head or the disc, that is optic disc, tapetum lucidum, non-tapetum, and the retinal vessels by shining a light to the pupil of the eye. The disadvantage of this instrument is it provides a limited view of the fundus, and further evaluation may be required if any abnormalities are present. So if you want to see the fundus clearly, the tool is the indirect ophthalmoscope. Also, patient cooperation is very essential during examination because you're going very, very close to the patient with this. So any aggressive dog or any aggressive pet comes to you, supposing a cat comes to you, it's very, very difficult to handle by this instrument. I generally use indirect ophthalmoscope. I'm quite comfortable with that. This is a tool used to examine a dog's eye by allowing the examiner to see the fundus or back of the eye. Now, what is done? This is an indirect ophthalmoscope. This is like a headgear. It has a light source, plus it has different filters of light. And this is a lens in my hand, which is a 20 diopter lens, which I use to see the fundus of the pet. So I wear this. The lens is in between my index finger and the thumb, and the middle finger is on the above the eyelid of the pet. So I place it like that, and the light source goes from this to the lens and then to the eye. It is a very, very good tool, but it requires a lot of practice to get the image right. Also, the major disadvantage, I won't call it a disadvantage, but major drawback of this is like you get an inverted image. So whoever can analyze this inverted image like upright, it's very, very good to analyze the fundus. Only it requires the lot of practice, but it's a wonderful tool. Now, coming to the benefits I already discussed of indirect ophthalmoscope, it allows the examiner to see more of retina. You can see this complete retina in an indirect ophthalmoscope. Safer distance, the examiner can work at a safe distance from the dog. Then there is a stereoscopic view. The examiner can see the fundus in 3D with binocular ophthalmoscope. It is easier to examine peripheral fundus. The examiner can more easily see the back of the eye. Now, I would like to explain you the fundus of a normal pet first, and then I'll come to the abnormalities. This is a fundus of the normal pet where you can see a complete tapetal shine. This is the cilioretinal artery. This is the retinal vein. Basically, this is the optic disc, and this is the physiological cup. Now, when a dog or a pet who is completely blind and comes to you, there are many things comes in your mind. How is the vision? What will happen? So this is a very good tool if you want to invest in. That is an indirect ophthalmoscope, with which you can visualize at least this much. So when a case comes with something like this was a case with progressive retinal atrophy. Now in this, there was a hyperreflectivity. If you can see, this is a complete hyperreflectivity as compared to this image. Then this is the optic disc and the optic cup. You can see the complete atrophy of the optic disc and the optic cup. Also, the retinal vessels and the arteries are atrophied. So there is not much supply. The redness, if you can see in common language, is not there. With retinal detachment, you can see the retina is detached. You can't see any kind of optic disc, optic cup, no vessels are seen. And this was the case of retinal detachment. So it's very good tool if you can examine the fundus very well. And with this also, you can give a good diagnosis to the pet parent. Now, coming to ultrasonography, it's also a very good tool. I use this tool in my routine practice. It is a simple, safe, and a non-invasive method to examine the internal structures of the eye in case of opacity of otherwise clear ocular medium like cornea, aqueous lens, and the vitreous. We can use, or I prefer curved microconvex. The patients can be allowed to stand or sit with the head securely by an assistant. You can make them sit in a sternal recumbency or make sure you put a local anesthetic. Also, when examining with in case of blepharospasm, I mean, there is too much of spasm or corneal damage or globe trauma, where the patient is uncooperative, you can close the eyelids and just put the probe over the upper eyelid, and then you can judge the images. Now, this is a normal USG of the eye. This is the anterior chamber. This is the lens, the vitreous, the optic disc, the optic nerve, the retrobulbar fat, and the retina. Coming to a more detailed version, this is the anterior capsule and the posterior leg capsule. In between lies the lens, the anterior chamber, the layers of the cornea, and the ciliary body. Okay. Now, I would like to discuss certain ultrasonography cases which I had got, basically for cataract, retinal detachments. This was a husky, Tyson. His name was Tyson. He was 4 years old. He had complete opacity in the lens. It could be seen that he has cataract, but such a young pet having cataract, nowadays it's getting common, but such a young pet having cataract was little rare to me. So I decided to go for an ultrasound to see any kind of further retinal detachments or vitreal degeneration is there. Once I did the ultrasound, I can show you this is the anterior capsule, this is the posterior capsule. The retina was intact. The optic nerve shadow was also quite good here also. But only the thing is he had mature cataract, like a cortical cataract, hypertrophic images, hypertrophic structures were seen in between the both the capsule. Similar with this, he was a fox terrier, Leo, 8 years old. You can appreciate that's a lot of cortical or nuclear cataract you can see. You can see in between the two capsules, the anterior and the posterior, a lot of structures you can see. Here you can appreciate it more. Now, coming to one more Siberian Husky who was 1 year old, he also had a cataract, but he had a little vitreal bands over here. So it might be a partial retinal detachment case due to cataract. All these cases, it was very surprising for a 1 year old pet to have such. So the sugar was done, the diabetes was checked, everything was normal. So basically, it was a juvenile cataract. Now, this was a case. His name is Kalu. He came all the way from Nasik to me, and he came with a history of banging. He was continuously banging against the walls. So whenever when he came to me, when he approached me through my clinic, he was banging on the right, banging on the left, everywhere he was banging. And but overall activity and overall appearance of the pet was quite good. He was healthy. The skin was shining, everything was good. So this to happen, I was surprised. Why did it happen? So when I asked the history and everything, I asked him the history. Like he's fine. He's not only eating in 2 3 days. That was the history they gave. Then I asked them whether since 1 month or something anything has happened earlier. So they told me he had very high fever that time, but now it is okay. That struck my mind. Very high fever. I did a blood work for the same, and to my surprise, there was Babesia canis with a low platelet count in the blood work. So I did an ultrasonography where I could see the retinal detachment. It's a clear retinal detachment case where you can see a morning glory sign or a seagull sign, which gives a clear retinal detachment. So basically, if they were to have come earlier to me, like a month back, and we had done PCRs and everything, and the right treatment would have started, maybe this could have been sorted. So early diagnosis and early treatment is very, very essential to save the vision. Now, coming to one more case, which had come recently to me, like a week back, it was a Shiro. He's a 12 years old Maltese. He has both eyes cataract. But when I did the fundus examination, I felt there is a retinal detachment because I could see the fundus images of retinal detachment. But I wanted to confirm it before going ahead with the cataract surgeries. So I did an ultrasound for the same, and to my surprise, both the eyes had retinal detachment. See, you can see a retinal detachment. So whether to do a cataract or not, now it completely depends on the pet parent, because even after the surgery is done, it's very difficult that the pet might be able to see. But certain pet parents do come that we want the cataract to be removed. We want his eyes to be saved there, though there be retinal detachment. This was one of the case, which was Sam. He also had a retinal detachment who was blind. Now, coming to one more good tool and an advanced tool where we call a CT scan. It's a key tool in ophthalmology for diagnosing and treating eye and orbital diseases. It helps in assessing orbital osseous lesions or soft tissue lesions that cause bony erosion. Also presence of any calcification to differentiate acute hemorrhages from any kind of mass occupying lesions. Now, this was a pet who had come to me. He had come, basically the eye was bulging. So he came to me to show the eye. But then I did the facial symmetry. I could feel that something is bulging, and he had lot of discharge and bleeding from the nose. The something somewhere was going wrong. I did all the blood work. Blood work was quite normal, nothing abnormal. I did the X-rays. I couldn't see much in the X-rays. So the pet parent could afford, like, please do the diagnosis. We need to know what is happening. So I advised them CT scan, and they went for a CT scan. We did a CT scan under mild sedation. And to my surprise, there was an abnormally large soft tissue density destructions and extensions into the right orbit. These extensions were also into the contralateral nasal cavity. The appearance and morphology of both of these were highly suggestive of neoplastic process. This was a CT scan we did. Now, coming to the last modality of diagnosis, and one of the most important, which can give you a 90%, 90 to 95% accuracy whether the pet can see or not, is the electroretinography. It's just like how you go for ECG, it is same like that for the retina. So it is a non-invasive procedure that measures the electrical activity of dog's retina in response to light. It's a common tool for diagnosing retinal diseases and evaluating the effectiveness of the treatments. Now, how it works. Firstly, electroretinography attaches a lot of probes and a lot of chambers on the corneal surface. The dog has to be adapted to dark room for an hour, and then we anesthetize the dog, and then he undergoes the procedure called as electroretinography. A contact lens is placed on the dog's cornea. A light stimulus is placed close to the eye, and how he responds to the flashes of light is recorded through these electrodes on a software. Now, what is it used for? It is used for basically very good tool for progressive retinal atrophy in dogs. Now, this is a genetic disorder, and some breeds like Cocker Spaniel, Lhasa Apsos have this genetic problem, which is progressive retinal atrophy. So, whenever a pet who has a cataract, like Cocker Spaniel or Lhasa Apso, who comes to me with cataract, I generally do this test because even after the cataract is there are chances that this pet might go into progressive retinal atrophy. So we understand before in hand whether he is developing such things or not. Right now, there are a lot of gene tests also available which tells you progressive retinal atrophy. But this is a very good tool. It can also tell you once you've started some treatment for the retinitis, optic neuritis, or something like that, how treatment is working, and also assessing the retinal function, if the retina is functioning properly or not. The ERG is just shown like a waveform and response to light. Recently, I've got this machine. So this is like I'm working on it. I've done 2-3 cases. This is like a Hodgman's electrode. We attach this to the, and flash of lights are continuously put. This is the ground electrode. This is a reference electrode. And we get some kind of flashes or the waves like this. This is a scotopic ERG, photopic, and the photopic flicker. Now, this is a normal. In cases of SARS, like sudden acquired retinal degenerations or like retinal detachments, or you can say PRAs. This is either flat or little bulge you can see between the A and the B amplitude. Before ending my presentation, I would like to thank Entod Pharmaceuticals for giving me this opportunity to present this topic. I would like to say, I need to say thank you.
Thank you, Dr. Madhura, for a very informative lecture. Now we welcome any questions from the viewers.
Yes.
Yeah, can I ask a question?
Yes, yes.
Yeah, Dr. Madhu, you mentioned about the instrumentations. Would you also enhance the company names or some brands which you are very well versed and you like them, or anything of that sort? Because most of our practice we have the fluorescent dye, we have this STT strips, which are easily available. But the indirect microscope, sorry, ophthalmoscope, and the this thing, that other instrumentations, any particular brands which you are okay with it?
Yeah, one brand is Appasamy. I'm using their instruments. So that's a good brand. It's a human brand, but it's a good brand. Questions?
So we can also, like, you also mentioned that when you get a patient to the clinic, you prioritize by walking and everything. So there are a lot of times
Yes.
in a rush, and the daily practice may not help us do that. So do you advise anything for us to tell them at home to take a video or something of that sort, or some other tips, practical tips for the pet parents?
So basically, when the pet parent comes to you and you think you have a lot of patience and you can't see the eyes correctly, at least basic tests you can do is first is the PLR. That's just shining a torch into the eye of the pet patient. You can just get like a 1 or 2 seconds that tells you many of the things, which is whether the PLR is present or not present. The basic reflexes you can do. That one thing is there, and the two more tests, that's the Schirmer and the fluorescent, that you can practice. And if you can't get much of the diagnosis from this, then you can tell them to click a video at home. Ki how is he walking in the day? How he is in night? How he is when you shine, when you flash, when you switch on the lights in the house or in the room, how he responds to that. That video also can be good evidence for the retinal disorders. So you can further conclude your diagnosis.
Also, would you be highlighting on something on the treatment aspect, or it is just right now diagnostics only?
Diagnostics. Treatment was done last time.
Okay, okay.
So there are few questions. So can Dr. Narendra Chauhan, can you just answer a few of them? Like
You want
when the
you want me to ask the
tonometry,
questions?
how do you prioritize the diagnostic tests when when you're dealing with the ocular emergencies? What are the most common diagnostic errors when we do all these things, and how they can be avoided?
Is it for me or for Dr. Madhura?
It's for
No,
you.
it is for you.
Well, when it comes to ocular emergencies, generally what I do, I make sure that it is not just the ocular emergencies. First, I'll do a complete, the physical examination, because, like suppose if we are dealing with a case of proptosis, so of course it is an ocular emergency, but there may be some underlying, serious condition, like it can be a case of automobile injury. So there are chances that it may be some pneumothorax, or maybe some rib fracture, or some, spleen, hemorrhages may be there in the abdomen. So before I mean, when I'm attending the ocular emergency, first I make sure that I am attending an ocular emergency and there is no some other serious underlying condition which I have to address first. And generally, when we talk about the diagnostic errors in veterinary ophthalmology, so there can be many ophthalmic diagnostic errors. Like when we talk about the STT, so when we are taking the STT test, what generally we do, we keep the strips in the medial side. And when we keep the strips in the medial side, what happens actually, just because there is a tear pool is there, the third eyelid is there, and just because of that, and there will be some, reflexes of the third eyelid. So in that way, there will be more reflex tearing. So there are very high chances that we may get some false reading there. So generally, we advise them to put the strips towards the lateral side, from middle to lateral side, so that we get the proper readings. And other than this, the diagnostic errors, I have to think about this. And sometimes, the anatomy is also not very clear to the most of the general practitioners. I mean, we get many referrals to my clinic. I get the cases from a very different places, a very far places, and they send it to me saying that this is a case of cataract. And when that case reached to my clinic, uh, then I realized that it is not a case of cataract, it is something else. So basic, anatomy should be very clear to the general practitioners. I mean, they generally do not understand the difference between the cornea, the internal uveitis problem, or problems related to the lens. So generally, it happens in the general practice that the practitioners that do not know what exactly is happening with the eye, and they simply refer it to some practitioners or ophthalmologists. So I have faced many such things in my clinic, and other than this, other than this, I mean, like few basic cases are there, like dry eye is very common in cases of in our practice, and with the simple test like the shimmer tear test, we can diagnose it very easily, rather than trying all the medications, different type of medication. If we generally simply do a STT, we can diagnose many things. And so the few basic things should be very clear to the general practitioner. If those things are very clear, then they can make a very good diagnosis. So to diagnose a very good, just to diagnose a good ophthalmic disease or ophthalmic condition, you need to have very good eyes. If you have very good eyes, if you have very good observation, then just by simply your observation, you can diagnose many such conditions. You do not need to have some fancy instruments to diagnose the ophthalmic conditions. Just by the good observation, you can diagnose many ophthalmic conditions. Almost like 60 to 70% of the condition you can diagnose simply by your eyes, right? And your observation. And the
Thank
next
you.
question, yeah,
Uh,
pardon.
mm, the next question, either Dr. Madhura or you can answer. When do you decide to do how do you decide to do direct or indirect ophthalmoscopy?
Uh,
So one more
direct,
question is, when, yeah, please, Madhura.
नहीं बोलिए sir. Direct, generally, I used to use it before, but I am not that comfortable with direct ophthalmoscope. But just because it's you have to go very close to the pet's eyes. Though you flash a good amount of light, you get a smaller image of the fundus. When as compared to the indirect, you get a bigger image. You can rotate the lens from here to there, and you can see all the parts of the fundus. So generally, I use indirect ophthalmoscope over a direct ophthalmoscope. So you can add.
And one more thing is that in the direct ophthalmoscope, you get the upright image, and in the indirect ophthalmoscope, you get the inverted image. So initially, it's very easy to use the direct ophthalmoscope, but as practice more and more, indirect ophthalmoscope become quite easy to use, and it is. I mean, nowadays I rarely use the direct ophthalmoscope, but it is always the indirect ophthalmoscope only.
Thank you. The next question is how when do you think the tonometry should be performed and how do you interpret?
Uh, Tonometry generally is performed if you observe a pet's eye. If you see any kind of a corneal edema, like, basically you see a white eye or a corneal edema, and you see the vessels, that is the episcleral congestion or conjunctival vessels are too much engorged, like when you just observe and you see like that, it is advisable to do tonometry. Tonometry, normal pressure, intraocular pressure ranges from 10 to 25. Anything above, you can say 30 to 35 can be called as glaucoma or the early stages of glaucoma. I have seen cases where the intraocular pressure has gone to 75 and 80 in basic cases of corneal edema or something, where the eye appears completely white and swollen, like a ophthalmos eye.
For next question, you have already talked about it, but still, what is the role of advanced imaging like CT, MRI, play in diagnosing ocular imaging?
I already discussed in my presentation, but I would still like to repeat. CT definitely helps with any kind of retrobulbar masses if they are there in the posterior side. Also, if those masses are pushing the eyeball ahead or any kind of connection with the other eye or with the nasal passage or something. I had done a case like that, which I explained in the presentation. So CT helps there very nicely.
What are the early diagnostic markers for diagnosing progressive retinal atrophy?
Only diagnostic markers we can use, one is ERG, and there is now genetic testing, that is a PRCD, progressive rod cone dystrophy, that is just started recently, that can be used. These are the genetic markers. I
How
can't
can
hear you.
you identify and confirm KCS? That also you have actually explained. The question is there. So
We use Schimotier test strip to diagnose cases. We put in the lateral canthus, and any reading which goes, if it's advanced cases, the readings can range from 0 to 5 or 5 to 10. So depending on that, we diagnose cases.
last question is about how can the genetic testing complement the ophthalmic diagnostics in breeds predisposed to ocular diseases?
In PRA, progressive retinal atrophy, the genetic testing is available. So if a typical breed is susceptible to that gene, if the gene has been tested, the further breeding will not happen of that specific pet. So here the gene testing plays a very, very major role, especially in breeds like Cocker Spaniels and Lhasa Apsos, where progressive retinal atrophy is majorly seen after the age of around, you could say, 8 to 9 years. So you can definitely genetically, basically when they are small, you can genetically test every breed, which is Cocker Spaniel or Lhasa. If you want to breed them, you do this genetic testing. If they come positive, then the breeding has to be avoided.
These were the questions till now. And are there any more questions?
Any more questions from even those who are panelists? So honorable panelists can also contribute.
Like Dr. Madhura has given a very good, very nice and webinar, and it was very informative. Thank you very much, Madhura, for informing us, for
Thank you, sir.
revising all the things, because like nowadays studying is in your busy practice you cannot read each and every day. So thank you very much for giving us a very nice presentation.
Yes.
I have no questions for you.
Now I can proceed with,
Right.
we have our Vice President Marketing, Mr. Kamil sir, with us. So he will just highlight our corporate PPTs.
Good evening, everybody. At the outset, I would like to thank Dr. Madhura, Dr. Narendra, Dr. Neha, Dr. Nilesh for allowing us to be the part of this wonderful webinar. I will be sharing my screen. I will be talking about the corporate thing. So I believe the screen is visible, everybody. Yeah. So, Endor Pharmaceuticals, quality, innovation, and research. Just a moment. Yeah. So, Endor Pharmaceuticals, quality, innovation, and research since 1977. So, I'm Mohammad Kamil Khan. I'm the Vice President, Endor Pharmaceuticals. So, gratitude to the mother and son duo, late Mrs. Rukma Vithal Masurkar, late Mr. Gudas Vithal Masurkar, who are the ideal one, who are the leaders. Because of them, the Endor exists. So who are we? We are India's fastest growing top 5 specialty ophthalmic ENT pharmaceutical and healthcare group, supplying to over 67 countries worldwide with a global team of over 2,000 people and over 300 products sold globally. We have been creating waves across the globe since 1977. And of course, we have been part of the headlines, the Economic Times, Express Pharma, Financial Express, Biospectrum, everywhere, wherever NTOD is being mentioned is because of the quality, innovation, and research. And we are often being called as the Elon Musk of pharma industry and the Tesla of the pharma industry, wherein we keep on innovating and coming up with various brands which are not only first in India, but also first in the world. These are the part entered pharmaceutical, UK and regulated markets, research and development, which is being taken care by entered research cell as well as Medisearch laboratory, which is based at Mumbai. This is the division ENT OD entered. Basically, it is the full form of ENT, ophthalmology, dermatology, and here comes the veterinary division, which we call it as fur by entered, which will be taking care of our furry friends. We have the highest quality assurance and the standards. A quality matches the European and Swiss standards. We are one ISO 9001, 2015, 13485, and 2016 certified. We are having a state-of-the-art manufacturing unit and a global manufacturing network, which is complying with the US FDA, MHRA, WHO, GMP certification. And our formulation is the state-of-the-art research development laboratories, which is FDA and DSIR approved ophthalmic and formulation research and development center. So I just wanted to show a video of a recently innovated research and development laboratory. So that was the video of our R&D unit where the magic happens, where the innovation happens. We are having the world-class infrastructure at the heart of Mumbai financial capital. We are also having a national and international field strength of over 1,500 field representatives Overall, 1,200 field-based sales staff working across India and over 300 in overseas markets to promote the high-quality products. We are also a quality-driven system. We have the quality being which has been affiliated to the ISO standards, good laboratory practices, WHO GMP certification, MHRA, Swiss accreditation, quality certifications. We are having, as I've already mentioned, we have over 300 commercialized products globally, which comes into ophthalmology, ENT, respiratory, pediatric, analgesic, oncology, general. So out of these, 150 are registered trademarks and 6 patents have already been applied for. And of course, we have a very good track record in terms of the recording annual growth of almost 11%. So for the past 6 to 7 years, we have been continuously maintaining a growth of double digit. So this is the figures of November 24. So we are growing at a rate of 11%. We are also offering world-class academics in terms of Entomeet Online with the help of World Glaucoma Association. These are the allied foundations or the association to whom we have collaborated for the world-class academics. American Academy of Dermatology, World Society of Pediatrics, Ophthalmology, and Strabismus. We are also participating in national and international conferences, and our global presence is over 67 countries, including Middle East, Russia, Egypt, Philippines, Malaysia, Europe, Australia, Turkey, South Africa, and UK. To support the postgraduate, we are also having some of the programs named Netrayatra, wherein we are helping the PG students for their life throughout the college days. And we are also having collaboration with some of the elite academic institutes like All India Institute of Medical Science, Narayan Nethralaya, Netrathama, LV Prasad Institute of Eye Hospitals, PBMA, HV Desai, PGIMR, which is in Chandigarh, Sankara Nethralaya. And of course, we are having initiative in terms of the apps or the YouTube channels wherein we will be creating public education awareness in terms of the videos, which is from the doctors itself on the major topics. These are basically the eye, skin, and ENT public awareness videos. So we also have recently launched Vet Health for by Antod, which will be talking about major topics on to the vet health, vet hygiene, and the modes or different awareness videos related to the pets. We also have some of the applications like Eye Assist and OperRx Timer. These are basically the smart eye medicine reminder mobile applications. We have the foundation, the Mathanan Welfare Foundation, wherein we believe in giving, and because of this we have been associated with national patient eye health awareness campaigns in terms of myopia management, pledge to donate eyes. We have the website Pledge My Eyes website, wherein the pledge can be done by simply 2 clicks. We are also participating in the World Glaucoma Week. So basically, with the help of Mathanan Welfare Foundation, we take care of creating awareness for the eye health or eye health programs. We have recently launched veterinary eye and ear care range. We are proudly supporting PETA as well. So the division name is Fur by Entod, which we will be taking care of the furry friends. So let's have a look, small video of this.
Kamal sir, the sound is not coming.
Yeah.
Can you just stop share for a minute?
Yeah.
On the
It's fine. It's fine. It's fine. It's fine.
Okay.
It's fine. So it will be coming now. Right. So that was the video for the fur by Antod. We have greatest range of the eye and ear range for the veterinary or vets. So starting from the sodium carbonate, dexamethasone, loteprednol, combination of tear substitute, combination of antibiotics as well as the steroids, the soft steroids in the form of eye drops, eye ointment, eye gels. So this is basically sodium bicarbonate, the other tropicamide phenylephrine, sodium chloride for the preventing the cataract formation, travoprost in terms of glaucoma treatment, for VKC, vernal keratoconjunctivitis, or any corneal infection, we have the tacrolimus plus cyclosporin. So these are the some of the brands which we have been there. Apart from this, we have also been trying to come up some of the brands which will be unique first time in India for the pets. So soon we will be disclosing or we will be coming up with those brands as well. So we are a dharmic company which, as you see, that the lotus always bloom in the muddy water. So with in spite of all those hassles, we will also be blooming. We are a family-based culture. We believe on value system, and the philosophy of Antod Lego is that we will be blooming how irrespective of how the muddy water, how challenging the situation will be. So we will be making our karma into our mission. So that's what about Antod. So thank you very much for being the. Thank you very much, doctors. I would like to express a gratitude to all the doctors who have been associated with this webinar, the series of webinar, wherein this has been really played an important role in terms of creating or energizing or giving some information with respect to the recent trends in ophthalmology in terms of vet case. So over to you, Madhura ma'am. Thank you very much for that.
Thank you very much. It was a great session. We could revise our basics and get into the world of diagnostics. Thank you so much.
Thank you, doctors. Thank you.
Thank you.
Thank you. Thank you all for this